here at the German Congress of Endocrinology in Baden-Baden with my very good friend Linus Haberbosch, which is taking over the Pituitary Outpatient Clinic in the Charité in Berlin from Professor Strasburger. Linus, if you can present yourself, and as a young doctor who's facing this challenge, what are the main challenges you found when you take over this important position?
Yeah, Mario, thank you for the opportunity to tell you a bit about myself, and thanks for the interview. I think so. I'm just basically since 4 months the coordinator of the Pituitary Tumor Center of Excellence at Charité, and that's of course in that stage of my career I'm in a pretty challenging position. I'm doing quite a lot of interesting studies at the moment. I'm working on molecular imaging, which I initially learned in Cambridge from Professor Martinell. I have some projects going on there, and I'm establishing quality of life measurements in our department, patient-reported outcome measures. But in general, all this I'm doing at the moment wouldn't be possible without the support of the entire clinic. So I'm not alone there, obviously. I have a fantastic mentor in Christian Strasburger, who is an eminent scientist in the field and who is still supporting me as a senior professor, so we're actually still sharing a room. And I also have fantastic colleagues who support me, so it's not just me, I'm placed in a network that actually works. And that's something I can also recommend to everybody watching, that you should have a network as a young scientist to really help you grow. And you're part of that network obviously too, so I'm really glad to have this conversation with you.
Thank you so much. Linus, what are the main challenges? Because I can imagine as a young doctor, sometimes, I don't know, asking for, let's say, money or for support, sometimes can be difficult. How do you deal with that?
Yeah, so there are several challenges everybody's facing, I think, especially in the German system, which is you're basically always torn, this is a clinical researcher, between patient work and science, so you have comparatively at this stage of your career less time to actually write grants, to get projects rolling. You still have to treat a lot of patients. Sometimes you're still in your Facharztausbildung, so you're training as a specialist. And that just means again that you're even more in need of people who help you, who work with you, in need of mentors and collaborators, so that you're not doing 100% of the work on a project, but that you have people who help you, and that can really facilitate getting some money together. And obviously, if you get one thing through, then the rest becomes a bit easier, right? It's sometimes it's a small starting grant which allows you to then get the next one and just build it step by step. And don't let yourself be discouraged by not so successful grant applications. Just keep on going.
That's a very cool, important point. Yeah. What are your suggestions for young endocrinologists who would like to do your career and to try to get to your point? What would you suggest to them?
Well, now I'm starting to repeat myself, but I would just recommend to go out and talk to people, to find people who you can learn from. If it is a mentor, or if it is just a collaborator, someone on your level, above your level, everybody's got something to teach you, and from these experiences you can just grow as a person, as a researcher, and that will just enormously help you. And don't be afraid to, on conferences or on other opportunities, to just go up to people and talk to them. So researchers mostly like talking about their research, so they won't be mad at you if you ask them a question, or if you propose something. They'll mostly be interested, and that had really helped me. Without my time with Christian Strasburger, without my time in Cambridge, I definitely wouldn't be anywhere near where I am today. I'm immensely grateful to the people who supported me, also my director, head of clinic, Maya, who has also been supportive and took a chance in promoting a young researcher to this position. So just find people around you who are willing to help you, to support you.
And regarding the people around you, I can imagine that not just people at work, but also people in your social life. How do you manage also all the relationship with them, even if you have a lot of work? How do you balance it? Do you have any suggestion also for young endocrinologists on that?
Yes, thank you for the questions. And this feels like the Oscars moment, where I now have to thank my wife for supporting me in these trying times. But seriously, so that's obviously one of the points. I'm very happy to have a wonderful social life with my wonderful wife, who is very supportive through times as a researcher where you have to just work very hard for a couple of weeks and then it eases a bit up. And she's very understanding. She's also a fantastic researcher herself, and used to do some work in venture capital, so she understands also that sometimes you just have to do the work. But it's, on the other hand, so aside from a partner and from friends who just support you, even if you're very busy at times, there is also the part of social life you need to just unwind and to recollect yourself, so that you don't get all mixed up just inside your own head and you walk into a burnout. And for that, for example, together with my father, I have a small distillery in the countryside in Germany where we distill craft spirits, and just to work with your hands again and to be able to make some little thing happen is a very nice balance to the research work I'm doing on the other side. So I recommend keep people around you who help you, who support you, and keep at least one hobby that really helps you.
It's a very important suggestion, also like to get really the head off. Linus, thank you so much for this interview and thank you for your time. So much.